Hello, everybody. Again, a small little talk about anxiety disorder of children. We are, as per already discussed about what it is, what are the symptoms, what the types. Now, how can this anxiety disorder be treated? Types of treatment that can be offered depends on what is causing your child's anxiety. Counseling, it can be helpful for child to talk in confidence about what is worrying them to a trained person, especially if someone they do not know. If child is being seen at camps, they might see a child and adolescent psychotherapist or clinical psychologist. If they are youth counseling service, it will be trained youth counselor or psychotherapist. These sessions can help them work out what is making them anxious and how they can work through these situations. So it is about knowing much, about their situations. That is very, very important, and that this they are all be helped with that. So basically, how can this be treated? Counseling. So already mentioned that also there is cognitive behavior therapy. Cognitive behavior therapy is a talking therapy that can help children to manage their problems by changing the way they think about it. It has been proven to help the anxiety and when it is severe and commonly offered to the young people who are anxious. Your child will work with a therapist to find out ways to change the way they think about, find strategies to cope this situation that make them anxious, and they will usually have 9 to 20 session. It is not clear whether it is effective for younger than 6 years. It is not sure about it, but above 6 years it can work. Medication, if not getting better with these therapies, think about type of antidepressant. Selective serotonin active inhibitor may help to feel calmer. Antidepressant usually taken around 2 to 4 weeks to work properly. It is natural to concern about the side effect, and the child should aware about the possible side effect. Um, so, what you can do about that? If your child is experiencing anxiety, there is plenty of parents and carer can do to help us. Important is that you have to talk to that child about their anxiety and worries. Um, why some of them are affected, others are not. Some of them born a bit nervous and anxious, less able to cope with the stress than other children. A child's anxiety personality partly determined by the genes and inherited by the parents. Parents of anxious child may recognize the signs and remember feeling and behaving the same when they are younger. So, stressful environment can pick up anxious behavior, being around anxious people, and develop anxiety after a series of stressful events. May be able to cope with one of these events, but several difficult events together may be too much for them to cope. For frequently moving house or school, divorce, separation of the parents, a new step parents and siblings, parents fighting, arguing, date or close relative, friends becoming seriously ill, injured in an accident, someone in the family ill or disabled, and school related issues like homework, exam, bullying, or friendship problem, become involved in crime, being neglected or abused. Also, some medical condition like ADHD, autistic spectrum, experience anxiety as a part of their symptoms. And the conditions, they're different the way their brain work. How common anxiety in children? Nearly 300,000 young people has in UK has anxiety. So anxiety disorder is 5 to 10, 19% of children and adolescent, and about 2 to 5% of the children younger than 12. Separation anxiety is the most common anxiety disorder in younger than 12. So this is all about nightcell about anxiety. We'll try later to discuss further about helping in the parents about your child's anxiety, how you will deal with this a bit more. Thank you for watching Healthy Talk. Stay healthy and keep your family healthy. Bye bye.